fat, because what happens is when you take out these big lumps, you have depressions there, and patients come back saying, I'm not happy. So in these cases, I would definitely look at fat as a filler here. Many physicians report no complications with semi-permanent fillers. What I do urge you is if you're having problems, please do put it so that we can learn from this. Both patients were emotionally distraught and were surgically inclined, okay, after non-response to intralesional triamcinolone. So the aim was really to show you what complications you can have. Informed consent on the sequelae when working with injectables is mandatory, and it's important that the aesthetic subject appreciate the difference between biodegradable and non-biodegradable fillers before your treatment is given. Choose your patient carefully, and in India we have less regulations, so newer fillers are being introduced with the possibility of increased complications. I'm going to present a little bit on the injector pen. We've had it in our office for about a year now. We've been injecting fillers. I find that it minimizes complications, it minimizes your manipulation, less painful, less bruising, increased patient comfort level, but it's a very expensive device. The injector pen is really a device. It's an electronic injector system. So this is what it looks like. And I have no disclosures to this lecture, so I'm just telling you our experience because we've already got this device. But all my filler patients who've had a filler done by me previously and have now had a filler done with the pen, they say they are more comfortable and they like the technique better. So what it does is, I'm going to just show you, they've done studies of course where they've had fewer side effects, less pain, no need of anesthetic. This is what it looks like. So what you do is you put your filler, any hyaluronic acid. This is not a one company thing. Obviously it's made by one company, so they advocate you use their filler, but multiple hyaluronic acid gels fit into this. You put the filler into this, your injection is controlled with a foot pedal. So you're actually pressing on the foot pedal, you're injecting with the pen, and you're controlling it. So it's a very smooth withdrawal. As you press the foot pedal, you withdraw the pen and you're injecting your filler. So you're not pushing, you're not putting pressure, and there's minimal manipulation on the patient's skin. So everybody's more comfortable with this. I definitely find I have better control. And you can also do drop methods. So in terms of if you're doing a linear threading technique or you're doing a searing puncture technique, you have the flexibility to do both of those with this. With fillers, technique, knowledge, expertise, proper patient assessment, a well-formulated treatment plan with access to multiple agents for different indications. So you use a different filler for around the eyes, you use a different filler in the lips, you may use a different filler for volume augmentation. In conclusion, the simplicity of use of these agents should not be misinterpreted as freedom from significant complications. Thank you.
I request Dr. Mahajan. I have a little announcement as well. Due to desperate request, we send them back at 12:15 because coming next is a very interesting session on Botox.
And she is presently the Vice President of the Cosmetic Dermatology Society of India. So we call on Dr. technique we should go forward with.
Thank you so much. I'm going to try and be very crisp and quick because we're already behind schedule. Botulinum toxin, I'm going to introduce